This conference will now be recorded.
Michelle is ill. She's having some reactions. I am ill, but I'll just be hacking for a while. So just let me know if you have something to say, and we're going to go around and just quickly introduce. Everybody knows everybody here, though. We'll see what's going on. I have something to say afterwards. So, hey, but Lou, how are you doing?
I'm doing pretty good. A little fatigue, but nothing like you sound. You
I don't
sound
feel as bad as I sound. How's that?
really?
Yeah,
That sounds upper respiratory.
it is.
Not good. Keep an eye on it.
Yep. Do you
Do
need
you
some
need
time
time
later?
tonight, Lou?
No, I think I might have shared the last time that my doctor's looking at a new clinical trial for me. My Kappa numbers are going up.
Okay, so we'll
Uh,
reserve some time for you. I'd like to know.
yeah, that's about, yeah, the new clinical trial.
Okay, great. Jim, how are you doing?
Pretty good, pretty good. Nothing for me, doing great on a treatment holiday now for over 2 years.
I hate you.
Not bad.
Nancy, good evening.
Hey, I'm good, and what, 4 months post-treatment, so just rebooting everything, and no, it's a beautiful here in Vermont.
I'm on my way to Maine the end of September. Would you like some time this evening?
No, I'm good.
Okay. Barbel?
I think I have to tell something. I've been missing for quite a while.
So we'll hold time for you too. Al, I know you need time. Leslie?
No, I'm good. I'm just gonna inner chime if I have questions about stuff, but that's about it.
Inner chime all you want.
Thank you.
And Mr. Lynn, Texas.
Yes, ma'am. Yeah, I'll maybe take a minute or two. I've got a new, let me just say it called Stevens Johnson syndrome that I'm going to talk about.
Oh, that's something new.
If
Good.
anybody's ever heard about it, that's something I want
No.
to bring up. I have a friend that I think may have it.
Okay. Rick, do you have anything you want to start off with?
Absolutely
Okay.
not. Please go.
Well, we're
Thank
going to
you for
start with
asking.
Al because Al's been going through a lot.
Well, I had my meeting today with my doctor from Mayo, and I'm scheduled. Well, we'll get to it once we find a match for a bone marrow biopsy or a bone marrow transplant. Sally gave me a quick rundown the other day on what it all takes for that and what's all involved, and got a little bit more info on today. So, like I said, I'm just scared out of my skin.
Well,
I'm
like
not
we
looking
said,
forward.
Al, you need to step back one and explain to people where this has all come from, because they don't know.
oh, we did.
Well,
We talked about it before you got here.
So I was diagnosed with polycythemia vera, which is a rare form of a blood cancer in 2020. So this might be a mutation or whatever from that. So now I have MDS, and it's at a very, very early stage, which she's happy she caught. We happened to do a bone marrow biopsy here about 3 or 4 weeks ago due to another issue I was going through. And she was very happy that she did the bone marrow biopsy. Now, when they first looked at it, they were looking for progression for myelofibrosis. And as she looked at it a little closer with some of her co-workers or staff. I want to say they couldn't even see it with the microscope. It's so small. It's at the very, like I said, at the very early stage. But she's glad she caught it, and she wants to get in there now. Had we not caught it, then years down the road, yeah, it could have went. I probably would have been diagnosed with leukemia.
So Al, what's the timetable?
Well, for the bone marrow transplant, she's hoping to get it done like in 2 months. We're just depending on the match, so I don't know what's all involved, but she talked about sending the kits out. I'm waiting for a call. Probably supposed to get it today, but I'll probably get it tomorrow. Someone from Mayo that will be contacting my kids and my brothers starting there.
So familiar is usually better than someone else, is that correct?
Yeah, on this one, yes. Yes.
So with
In this
children,
group,
with
yeah,
children, the
younger.
best match would be 50%, I think.
Yeah. And she says they have a really large database that comes out of Germany. They get a lot of matches out of Germany.
Oh.
But I wanted to ask here, I'm not sure. Just raise your hand if you've had a transplant. Sally, just to Lou and Sally.
And can you
Anybody
clarify
else?
something else? Can you clarify something else for us, Sally and Lou? What is the difference between a bone marrow transplant and a stem cell transplant, or is it the same?
They're exactly the same thing. It's just a new name for it.
Okay, thank you.
Well, and I think a bone marrow transplant carries the image of drawing bone marrow out of the donor's bones to use to make the transplant. And I think with the stem cell transplant, they can actually get the stem cells out of the blood.
No,
Am I
they do
right?
it out of the bone marrow, but
Oh, okay.
what they do is they give you a drug called Neupogen, or what is it, Myloxin? Is it, Lou? Which forces those stem cells to go out of the bone marrow and into the blood. So that might be what you're thinking of, Lynn.
Okay.
You build up all these stem cells in excess in your bone marrow. You push it out of the bone marrow into your bloodstream, and then you can harvest it. And you need to get about anywhere from 6 to 8 million cells, and that's enough for 2 transplants. They always do one for extras. And I didn't have any trouble with it, but it did take me 3 days. Some people can do it in an hour, but I didn't. And
Okay, but
what are the balloons for, Lou?
I have no idea.
um,
I just raised my hand. I don't know
that's
why.
funny. All these balloons came coming up out.
I know. And my grandchildren have not been over here messing with my computer.
Anyway, the process of using Neupogen is one of the places where everybody determined and discovered that Claritin helps with that bone pain, because that is bone pain when you have to force those stem cells out through the
right.
bones. So
Yeah, I've had Neupogen because I had low neutrophil count.
right.
So
Right.
it stimulates the
So,
bone marrow.
Sally, what you're talking about when you force these stem cells out, are they harvesting stem cells from you to put back into you? Is this a
Yes.
self thing? This is
Yes.
a self. So this is different from what Al's talking about,
Right.
where he's going to get them from an external person.
From a
Aloe.
donor. Yeah.
Yeah.
Now,
From a
Lou,
donor.
you had a donor, didn't you?
CAR T. I
Oh,
had
okay.
an
You had a
allo.
donor CAR T. Okay.
Yeah, yeah. My stem cell was my own.
Yeah.
So there's CAR T, and what's the other one called then?
There's a stem cell transplant,
Okay.
a bone marrow transplant, and then the other is a CAR
A
T,
treatment.
a
That's
treatment.
a treatment, Leslie.
Okay, so they just call it a stem cell transplant. There's not another doctor name for it.
No.
Okay. Okay.
Except bone marrow
Right.
transplant. I mean,
Okay.
people call it that, but it's all the same.
Okay. So Al, you're getting stem cell transplant then, not CAR T.
And what they do is when they take it out, when they do it Lou, pronounce that word for me.
Autologous.
Autologous. When they do your own, it's called autologous. And they
Right.
spin the stem cells out of in the serum, and then they put all the plasma, or I mean, all the red cells back into you. So it's a closed loop. They're taking out one and putting the rest back into you.
So what is the percentage of rejection versus stem cell and cell transplant? Is there a bigger chance of rejection with one or the other?
There isn't a
There's no
rejection
rejection.
when it's your own cells,
Yeah.
but when it's someone else's cells.
Yeah, you could have a host versus graft.
Okay, that's what I wondered, because I've heard so many different people say that they've had a CAR T, but they've had issues with it, and I didn't know what the
CAR
issues.
T and stem cell are totally miles apart. They're nothing like each other.
Right, CAR T is the one that you do your own, right? They get them
No,
from
you do your own with stem cells. And you can do it with donor. But in Lou's case, she'd already failed one CAR T, and so that's why she got a donor CAR T.
It's rare. It's just clinical
Very
trials
rare.
that they're doing CAR Ts with someone else's cells. They just started doing it in clinical trials this last year.
Okay.
But
Okay,
CAR
that's
T is a treatment, and stem cell transplants are standard operating procedure in multiple myeloma.
okay.
They've got to get rid of as many of the multiple myeloma cells in your bone marrow as they possibly can, because myeloma will relapse. You know, they leave one in your big toe.
Right.
But it's also obviously a protocol in other blood cancers.
Yes.
Because Al is doing MDS. Now, the other question that I've been wrestling with, and Al too, is MDS is a precursor to CLL and SLL and AML.
All right, I put the
Is that
definition
right?
in the chat. I put the full definition in the chat.
Right. Well, there's a link. I see the link in the chat.
Yeah.
But what is that definition, Sally?
It's basically it's the cell is premature. I mean, it doesn't mature, and so it doesn't make good
Okay.
white cells, red cells, platelets, plasma cells, or anything else. So that's why you can progress from MDS to other cancers, but not necessarily. You can just stay with it, from what I understand.
Okay.
But
So
the stem cell procedure is, it's I don't know what Lou's experience was, but I was bored. I mean, I didn't get really sick. I had diarrhea like crazy. I wanted to sleep all the time. And it's a curve where they put in the methylon and kills all your bone marrow, basically. And then you're okay for 2 days, and then everything drops when all the white cells, red cells, and everything else are gone. So then you have a bottom plateau for about 3 days when you're really sick. And then you start engrafting, your body starts building the white cells, red cells, platelets, and other plasma cells. And by day 10 or 12, you can go home because your immune system is back, but not fully. I mean, you have low values for white cells, platelets, and everything. You go home and rest for about a month to 6 weeks.
Yeah,
And
I think everybody,
It's different.
obviously everybody's different. When I first did it in 2013, stem cell transplant,
I didn't know it
it
was that
was,
far back.
yeah, I've had this, for 11 years, but it's, I was told by a mentor that I had from our support group that by about day 7 or 9, you'll start to feel better.
Yeah.
Up until that point, you can have some fevers, definitely fatigue. That's a big piece of it. But for a month, your ANC, your absolute neutrophil count, can be pretty low. And they don't want you really to be around a lot of people, just
The
your
first 100 days.
caregiver. Yeah, your caregiver. You can get all kinds of infections, and you're very susceptible to a lot of things for about 30 days or until your numbers go up high enough.
Yeah.
But if you just follow the directions of your cancer center,
I sent him the guide, by the way.
yeah, they should have a booklet or a guide or something that they give you. We had to go through an orientation, like for a half a day, to find out how to take care of my husband, how to take care of me. So it's not easy. One of the nurses described to me that it's like we get you down as low as we possibly can without killing you. And
yeah,
basically,
yeah,
what they're doing is they're trying to get rid of as many myeloma cells or whatever cells, are in your body that are not good for you,
indeed.
to get you to a point where then you can accept, the engraftment of your infused T cells, so
No,
that it
stem
can
cells.
build you.
We're talking stem cells, Lou.
Yeah, stem cells to build you back up.
Yeah.
So
So the first
it
100
isn't,
days, you're pretty much in isolation.
it isn't easy, but it's doable. And like I always say, we could do hard things. We do hard things every day.
Yeah,
So
I,
it's, a lot of people have gone through this and come out the other side fine. And I had almost 3 years of remission or
And I had
positive
4.
response.
Yeah.
So, it's doable. It's not easy, but it's doable.
And see, you say it's not easy, and I thought it was a piece of cake.
But
I got rid of my caregiver after a week and a half.
I think that's more rare. Just from my support group, people in my support group, it's more rare, I think, for people to say it was a breeze or it was not a big deal. I think my support group, I would say about 2/3 said it wasn't fun. But
I didn't say it was fun.
it's doable.
It's doable. Yeah. And I did it on my own. I didn't have a caregiver after 2 weeks.
now
That's all.
when they graft the new cells in from wherever they get, do they do that all at one time, or they do
It
it?
takes about, Lou, about 45 minutes?
It's
just
not
like
very
a
long.
transfusion.
I got,
Okay,
a
it's just
couple
like
of bags. You know what it looked like to me?
Urine.
Strawberry margaritas.
Yeah, it did.
The stem cell
Okay.
bags. I got
Okay.
2 bags, and they look like strawberry margaritas, partially frozen.
And it smells like cream corn.
Yes.
Oh my gosh.
So
Okay.
Al, I understand why you're scared. I'm petrified for you. I
Don't
get
be.
that.
I mean,
No.
that's the,
You gotta be, once you've been through it, but before you go through it, you gotta be scared. I mean, it's just hearing everybody else's. I mean, Al, isn't that how you feel? You're worried about it because of what you've heard about it?
I'm terrified.
I mean, and that's what I'm trying to get across. I mean, you can be wary, but don't be terrified, because that stress is not good for you.
Yeah, well, again, I've heard this before, and it was brought up today in the meeting. Everybody's different. Everybody reacts different. So we just don't know how I'm going to take it. Some people, the chemo, it doesn't bother them at all, where other people it does. And then back to the caregiver, I had some other people in my family here, but my doctor basically said, if you raised the baby, you got this.
Yeah. Now, are you going to have it inpatient or outpatient? That was one of the questions.
Yeah, I think I'm going to be up there. She said I'm going to be up there for a month.
Yeah, but I mean, they may have on-campus condos like we did at City of Hope.
Yeah,
And that's
so that's what they're
outpatient.
supposed to.
If
Yeah.
that's, and then, because the first few days, and again, Lou, correct me if your experience was different. The first couple of
Mine was
days
outpatient.
I beg your pardon?
Mine was outpatient.
So was mine. I mean, the weather was still nice. We would go for a walk. We'd stop in the cafeteria and have something to eat. And this was, before everything bottomed out. When it bottomed out, I could still sit on the patio and get some sunshine. And it's much better than being stuck in a bed all the time as an inpatient. But also, it's important to exercise. You've got to exercise a little bit every day, because if you don't, you're going to be like me, and I could barely walk. So it took me about
And
6
when you
months to
say
walk.
exercise, just get up and walk around.
Yeah, just get up and walk around. Don't lift weights. Don't do anything strength-wise. Just
Just
move.
walk. Just walk. If
And
you're
keep
in the
hydrated.
hospital, they usually have a floor where you're located, where the stem cell transplant people are located. And usually they'll have, if it's a
No,
neuro,
he's going to be outpatient, Lou.
yeah, even though, for your first day, they do have places you can walk, but
Yeah.
some of the people have to stay at like a Hope house or something, close by, if they live more than like half hour or so away from it, if you're
Yeah.
outpatient. We didn't, because we live about 30 minutes or 35 minutes from the hospital, but some people had to stay at Hope House because they live 2 hours away.
Yeah, I lived 2.5 hours away, so they had they were very old, like condo units. But as long as they have a kitchen and everything, your caregiver can figure out what you want to eat. I mean, I didn't have any problem I wasn't hungry, I had no appetite, but I could still eat when somebody put something in front of me.
Yeah, I had mostly peaches. I tolerated peaches. The little dice peach.
Yeah. You get a weird sense of what you want to eat.
Yeah.
But Al, keep asking questions and we'll find the answers for you.
Thank you.
It is scary though, Al. I'm not, and Leslie, when you said you'd be, all of us, before we go through it, any kind of new, therapy or procedure, or it's scary. The unknown is scary. But the better I felt was because of what I heard from other patients who had gone through it. I felt better when I could talk to people in my support group who had gone through it and they came out the other side. When people who have come out the other side and have had some, good years after that, it makes it worthwhile and less scary.
Yeah, that's what we've talked about too, but it's getting to the other side now.
Sure. But, like I said, we can do hard things. I think all of us in this
Our warriors.
blood cancers, we do hard things all the time, and we could do that. We can do this. We can do what it is, what it needs, what it takes to get to the other side, to make sure that we can give ourselves more time. That's what I want, more time with my grandkids. I want to see my kids get, married, and I want to be at their, graduations and different things. And one way to do that is to do some of these therapies that extend our lives. I'm going on this 11 years with myeloma, and I plan to go on at least 11 more.
And
So,
you're in what? You're about 9th or 10th treatment? Different treatment?
oh yeah.
Yeah.
But I
I mean,
keep doing them, and it 4 clinical
he's
trials,
my hero.
4 clinical
Yeah.
trials, and possibly
Yeah.
one more that's coming up. So I just, you know what, one foot in front of the other. You
Yep.
know, what's next steps? Next steps. What do we do next? When one thing fails, what's next?
Right.
Al, do you have
And
any other questions at this point?
Oh, not right now. I'm just, it's just too much to take in right now. It's my
Over.
mind just pedals.
Yeah.
Yeah.
Find some CBD. Take some CBD. Get your mind back
So
down to normal.
that's a question I got for you, Sally. Is that where your CBDs kicked in after your chemo?
I'm not sure what that question. I'm talking about marijuana.
Yeah.
I
No,
think I'm talking
I
about
take.
DVD, host versus graft.
No, the CBD that
Talking about
your
Yeah, I take it just to get the edge off.
Right.
And
yeah.
it's over the counter, and it really helps. And if I need to sleep, I
Right.
get the ones that have 3% THC, and then I
Right.
sleep.
So was that after your transplant?
I
You
actually,
still.
yeah, I think I started it at that point. Yeah.
And it made you feel better.
Oh yeah. It just cuts the edge off. It keeps your mind from running around in tight little circles.
Right.
Right.
Right. Right.
It
Right.
doesn't,
Right.
it does, and unless you have THC in it, it doesn't make you sleepy.
Right. Yeah. I mean, I hear exactly what Sally's saying, which is if you can stop that monkey mind, if you can if you can stay in the present and not think about all the things that could happen and might happen, you're going to feel better. Now, it's really hard to do that. We all know it. But what Sally is saying is, the CBD helps a little bit with that, and it helps you focus your mind on bringing it back and not letting it get away. And that's really what we're saying. I mean, the other thing I want to say to you, Al, is that look at Sally, look at Lou. I mean, they're both incredible people doing some fantastic work for themselves, for other people, and yeah, they went through it the first time as well. And the unknown is always difficult. But as Lou says, when you get cancer and it's a serious cancer, there's some heavy lifting to do. I mean, they told me I was going to be without testosterone for 3 years. Oh my God, what am I going to do? How am I even going to exercise? What am I going to do? But I'm not thinking
Get in the
about it for
choir.
years. I'm thinking about it one day at a time. And then you do it and you find you can do it. You do it the next day. You can find you can do it the next day. And before you know where you are, 2.5 years later, 3 years later, you're through it. And then you're coming back. But if you worry about what it's going to do to you, it's going to it does make you crazy. But it's so easy for us to say that, and yet that's what those of us who have been successful in our treatment, that's how we've done it. Because if we let it get on top of us, then it paralyzes us.
Then you can't do anything.
and then you can't do anything. So I want you to look at me, or look at from my prostate cancer, or look at Jim Marshall, who was 5 years, on that treatment, and look at him today. And then he has open heart surgery yet, and look where he is. And my gosh, if I was going to get nervous about anything, I think it would be open heart surgery. I gotta tell you, but we all get through this but by not letting the anxiety beat us up, which is what it wants to do, because we know we're going to beat it. I know you're going to beat it, but it doesn't help you. And you have to get your head to a place. You don't have to, but if you get your head to a place where you're thinking, I will beat this, I'll be ahead of it, you're going to do great. And
Right, and start advocating for yourself.
yeah.
So Lou, tell me what the good news is.
I was just going to say before I talk about that clinical trial is I always used to think, when I was first going through all of this treatment and everything and scared to death, what's the alternative? I can either face this head on, do what I can to survive and get better, or crawl in a corner and cry, and what helps me, what helps me the best. And so I've never been a person who has crawled in the corner and stayed there for very long. I'm usually a very upbeat, positive person anyway. I think it might be harder, maybe for people who have issues with some depression or something, or worry, if you're a worrier. I'm not a big worrier. I think about it, but then I go on. So I just don't want to crawl in a corner. I'm going to face this beast head on.
For you,
And with the help of possibly a new clinical trial. My Kappa numbers, Kappa light chain numbers are how my doctor determines, my level of disease. And so I'm just about a point under what would qualify me for a new clinical trial. And it's another CAR T. If I do this, it would be the third one. But each of the CAR Ts I've had have been different ones. The first one was called an Abecma clinical trial for Abecma. And it was my own cell, my own cells that were sent off, stem cells. And then the second one was, which I did last.
T cells, Lou.
Was out.
Don't confuse it. T cells.
No,
not stem cells.
Talking about my stem cell transplant.
Oh, you were just talking about your Abecma. That's T cells.
Oh, sorry. CAR T. Third CAR T. The CAR T was Abecma that I had in 2019. And then I had last November an allo CAR T where it was someone else's cells. And then this one that the doctor's talking to me about is a CAR T that's a clinical trial. And it's the target is GPRC5D, which is, if you're familiar with a bispecific tequitamab, or heard of that, it's also the target is GPRC5D, and it's a different target on the outside of the myeloma cell than BCMA, which BCMA, a lot of my treatments, all of my treatments up to this point have been targeting that BCMA that's on the outside of the myeloma cell. And so the clinical trial doctor, as well as my myeloma specialist at the University of Kansas, they both believe that my best bet would be to go with a different target. It's not going to be fun from the side effects that I've been reading and talking to my doctor about. And I mean,
What's the drug?
so I talked to a person who went through it in Southern California at the City of Hope that I was told about through Health Tree, other coaches. And so I got to talk to him. He was in Guam, or I don't know, for 6 months, and I couldn't get a hold of him for a long time. But he's traveling, he's living life, and he
Yeah.
went through the same clinical trial that I'm trying to get into.
What's the
And
drug?
I'm sorry, what?
What is the drug?
What?
What is the drug that they're using?
It's a CAR T.
I know, but you have a Becma and you have Cytocel, and so this one's got to have a name too.
It doesn't have a name attached to it other than the GPR C5D. I think it also is perhaps maybe connected to a BECMA, but the main target is not BCMA like a BECMA.
Yeah, it's been around for about 3 years, 4 years, but
But this is a
I'll
new
look it up.
Yeah, it's a new target. And it is at several, I think maybe 12 centers across the United States. It's listed in the .gov, clinical trials, and at the one at the University of Kansas. You can read about it. But it's got some pretty severe side effects, which are a little bit scary. After, especially, I know that everybody handles things differently, but the guy I talked to that went through it at City of Hope last year, his side effects were, very much what mab, the bispecific that targets the GPRC5D. So it's not going to be easy, and it's not going to be fun. And for a couple of months, he was in and out of the hospital. So I know it's not going to be fun, and it's not going to be easy. But I don't really think there's any other options at this point that I've checked out and investigated that will maybe be a better choice for me.
Lou, is this a phase 1 or phase 2 clinical trial?
It's 2. This one is a phase 2. The one I did in November was a phase 1 for the allo CAR T, but this one's a phase 2. So that sometimes gives you a little more information, on side effects, dosing, things like that. So it gets the doctors a little more prepared about what to expect, and the patient, about what to expect. And I know it's not, it's not going to be fun, but I think, when you've been doing this for a while, your options start to narrow, and the number of drugs, thankfully, we've had a lot of new drugs coming out over the past few years. Some of them, though, are very similar to what you've already had sometimes. So this one is different. It has a different target than what I've had before. And you know what? The more I think about it, the more I think, I can do this. It's not going to be easy, and I may lose my fingernails and toenails, have sores on the inside of my mouth, and all kinds of other things. But you know what? He did it, the other patient I talked to, and he came out the other side. He's MRD negative and living the life and traveling. So, we can do hard things.
Well, I think it's a plus that, like you say, they already have had the phase 1. They wouldn't be doing phase 2 if phase 1 was a failure. So that means it was something they can build upon, and it has some promise. So that sounds encouraging. And like you say, we're just kicking the can down the road. It just happens to be that we're the can that's getting kicked down the road, but we're just trying to get a little further down the road. And sometimes it's a big, heavy foot. Sometimes it's not such a big, heavy foot. But as long as there's something to kick it down the road, hanging in there.
Yeah. That's it.
Nancy has a question for you, Lou, in the chat.
Oh, I didn't see it. I'm sorry.
I just wondered when does this start? Maybe I missed when you said that.
It'll probably be not until, I'm guessing, November, December. I still have to, my numbers are just about a point away in my Kappa numbers. I have to have at least 10 in my Kappa numbers, and I'm at like 8.94. And it's been bumping up about 2 points each time I have my labs. So I'm guessing my next labs in a week or so will be, would qualify me. They can't start qualifying tests until that Kappa number reaches 10. So and the good thing is my, my disease burden isn't huge. It's still fairly low, and it is easier, I think, for people oftentimes to have good success with new treatments and drugs if your disease burden isn't out of control and accelerating at such a fast pace that it's hard for them to get it in control. But I think that's why they think that I'm a good candidate for so many of these clinical trials.
And you're willing to do it.
Yeah, a lot of people don't want to do clinical trials because it takes, some of that control out of your hands. You have to do more labs, more visits, more, it's very regimented. When you're in a clinical trial, they tell you what to take when, and you follow what the clinical trial protocol is, or you're out. You have to do it the way they're asking, because other people, who have this disease or similar diseases that are treated with this or could be treated with this, depend on you, so you don't mess around. I take clinical trials very seriously. I take what I'm supposed to take when I'm supposed to take it, and follow what they say. If they say don't drive for 8 weeks, or they say, stay isolated for 30 days, I follow those rules. I don't want to jeopardize the results of a clinical trial or my success either. So that's just me.
I was going to say, I'd
I'm a
probably
rule
not be a good
follower. I'm a
candidate.
retired teacher, so I'm very much a rule follower.
I was going
Well,
to
and
say I'm the
you've done
opposite.
this. You've done this, so you know what you're going to be going through as far as the clinical trial.
Yep.
You know what it's all about. My wife would not be good for that. She's
I wouldn't either.
Yeah.
Well, good luck to you, Lou, and keep in touch, will you? Barbel, where have you been?
I've been in the hospital since the end of June. My
Oh my
face still looks a little
goodness.
puffy because I'm down ramping cortisone from 30, and I'm down to 7.5 now. But I see my face is still puffy. Well, what happened was that after the COVID infection, I never really recovered. Well, I didn't have the COVID anymore, but I had cough and I felt weak, and I have problems managing things. So at one point, everybody said you have to go to the hospital. But the problem is I cannot say, oh, hello, hospital, here I am, or so. So I didn't do anything. But then my former sister-in-law, she said to her son, he should go and see how I am. He came and he said, oh, you have a fever. You have to go to the hospital. So I went into the ER, but I wanted to go to the University Clinic in Ulm, but we have a new law now that you have to go to the clinic which is in your area, which I didn't like, but I had no choice, you might say. what they found was that I had many bacteria in my blood. For example, Staphylococcus aureus, Staphylococcus epidermis, I don't know which ones all. So I got antibiotics to kill these, about 70 in all infusions. And they also found some CLL cells in the blood, but not very many, only 13%. And they had different cytogenetics than before. They did an ultrasound, and it came out that I had some enlarged ones in the belly region, about 4 centimeters or so, but the other ones were still small. Of course, the tumor burden was low. Then they said they needed to do a BMB to see more clearly what was going wrong. And in the BMB, they saw trisomy 12 unmutated CD38 positive. That is my normal diagnosis. So it actually comes from the bone marrow. And it had an infiltration of 90%. But the problem was they had to get the bacteria to go first before they could start treatment. I was going good, but then I stayed at a place where they gave me the wrong dose of medication, and my hemoglobin dropped again from 8 to 5, or no, 6.5. But the same day I had made the appointment in Ulm already, so they released me from that one clinic, and I went to the other one, and they kept me right away. And now I'm back on 8.6. I'm on venetoclax, 400 milligrams, and I'm at home again. But I'm still very weak because I've been in hospital since June. So things are not easy.
I'm so glad to see that you're home.
Yeah, I'm 75 now. My sons didn't think I would make it home. They have cleared out some drawers here, so when I came, it looked like a bomb had entered my apartment. It was really bad. And I thought, ooh, nothing is prepared. But the one son that takes care of me was told that everything was taken care of, but there was nothing taken care of. I had a nurse that comes in twice in the morning to look if I needed help. She does the medication, and in the evening to give me a shot against blood clots. She comes. So I have Meals on Wheels now. And well, I survive. I
Well,
can
we're
get
glad
up.
to see you.
I can get up. But I have to hold on to things, because I get dizzy easily. I mean, this was a long, long stay in the hospital. And, well, not enough exercise, too. And, of course, my age is not 75. I'm not a youngster anymore, definitely. So we'll see. I have an appointment on Monday for checkups if the hemoglobin, that was the main point, was the anemia. The anemia was in my blood count. You could see that the erythrocytes had a problem recovering. So, well, my idea was you have to get the cancer cells to go, and then there's enough space so the erythrocytes can start working again. 90% is a lot infiltration. So we up-ramped venetoclax slowly, and well, they're coming back. So I hope they stay. And they are my own.
That's good.
Yeah, I think that is also good. But I think I will have to go on a continuous therapy because this is my third therapy now. And well, the only thing is we have to figure out what dose I need because I have a very high, a relatively high key 67, which is a dividing factor, and it's 25. And everything beyond 25 is very high. So I'm just, you might say, on the border in a way. So that means if I have a cancer cell somewhere, it can multiply very fast. And so I want to stop this. And well, we'll have to figure this out. I think now, first of all, I will have to be on venetoclax for a while. They will keep checking. And then after 2 years or so, then we'll have to decide what to do. But as you can see, I'm still around.
We're very glad for that.
Yeah, because, well, everybody's surprised I'm still around because I had only a hemoglobin of 5, which is very, very low, and it wasn't clear why it is so low. They tried to find out, but at the end, they said it's probably CLL related. They couldn't find any other cause. But it was really strange, that there was a sudden drop from 8 to 6.5 just in one night.
Wow.
And in the morning, I was already feeling dizzy, and I said, oh, something must have happened. I'm not feeling good. But I made it to the clinic, and they kept me right away. So I was released at one clinic, and then the other clinic, I was accepted right away. And I was released at the end of August. I entered the other clinic at, I think it was the 7th of August, and I was released at the end of August, 28th or so. But now it's if we're still down ramping some meds, but before they did this in the hospital, and now they don't. You have to do it at home. But it's good they sent a nurse because, well, I know what to do, but many people don't have the knowledge. And if they take the wrong medication or the wrong amount or they confuse something, it can really be harmful. Well, they'll have to figure something out to help these people because just putting it on the relatives or someone who is not trained in the disease to treat or give medication, that is not a good thing because they will not recognize when something goes wrong because you don't really look that sick. Just like everybody says, you don't look that sick, and well, you should be jumping like a squirrel, Well, I'm not jumping. I don't know if I will be jumping, but I'm glad I can walk, at least in the house. And, well, I can manage my things. And, of course, I do a lot on the internet, which has really helped. This is another factor. If older people don't have an internet, they are really lost when they get old because you can make arrangements with your relatives on how to do things, who to contact. I actually arranged someone to pick me up on Monday to take me to the clinic, but it took several calls. I had to call my GP, I had to call my son, I had to call a central part which distributes these helpline. It's something like a helpline, and they arranged it, and. But I had to ask someone also again, how do I go about it if I need help getting me to the clinic? And so it was actually 4 calls and 4 contacts that I had to make in order to get things done. So here I am again. And hopefully I will stay that way.
Well, Barbel, it's just a day at a time. We're glad to have you back with us, and we've been concerned for you.
Yeah.
Yeah, I know. I received some postcards and letters, and people have been writing, and from because I'm in several support groups, they sent me postcards and well wishes and everything. I mean, that was also some help, because like I said, my sons don't live here. They one lives in Nuremberg, the other in Trashgreen, so it's quite a ways away. Plus, they have their own families. They work. One works 3 shifts. The other one has a sick wife and 2 little children, and he works too. They don't have no time for a sick mom, so I have to get myself together. This is now my 3rd treatment, but my first treatment was 3 drugs. The second treatment was 2 drugs, and now I have 1 drug. And actually, it's the core of the problem, the marrow. And I want to see how good I can clear it. We'll see. It's still a while, I guess, but I have to gain my strength back. That's important. And well, it is coming back. I fell the other day because
Oh no.
when I walk, I have to concentrate on walking. But I went into the kitchen and I got a bottle of gin. No, not gin. Tonic water, which I wanted to drink. So actually, I was only holding on to one wall. And of course, somebody had put a trash can in the hallway. I got stuck with the right foot, and there I was on the floor. I have a blue mark, a pretty bad one in the back, but I was able to manage to get up myself. So that means the strength is coming back because I could do that before, but uh, now I can do it again. That means I'm improving.
Good. Thank you very much for your report. But we want you to get better.
I do too.
Bill, you snuck in afterwards. How are you doing?
Me?
Yes,
Hi.
you.
Yeah, I came in a little late. I'm doing okay. You know, I have a CLL and I've failed or not been able to take, excuse me, 3 or 4 of the BTK uh, medicines, and I'm about to enter the Carney trial, Carney Bio,
Okay.
and perhaps last time I was ready to enter a few months ago, they disqualified me because I was taking pertobrutinib. So now they're going to medicine. Um, Now they opened it up to people taking Perto, so that's what I'm looking at. So, you know, I had a PET scan last month that was a little positive and also 2 negative. So I'm chasing the next treatment.
Good.
But I feel pretty good. That's important.
Yes. Nancy, did you have anything? I forgot. I've lost my list.
Well, thank you. But first, I did want to just say to Barbel, I'm so happy every time I see her. And I'm so grateful for what she posts on the internet. It's a lot of the scientific information that I can actually connect to, and it usually is very pertinent. And I just am so grateful. I know you're feeling better if you're posting on the internet, and it's not just flowers and kittens. Um, but then the other thing, I just and listening to Lou and Al, and it just kind of reminded me when I was looking at treatment. One of the things I was so grateful for was being the age that I am, and like I think Lou called it the disease burden being low, but just knowing that it was my first line of treatment, and so I really wanted to go hard after it. And when I was hearing Al talk, I thought how great that they found that, and they're going after it now. You know, they're not just letting it get there. Anyway, that was something. And then it reminded me that for me, I don't do CBD yet, but I do gratitude. And one of the things that helps me sort of face and work through my anxiety is to start thinking about things I'm really grateful for, like grandkids and time with grandkids and that sort of thing. And then the one other thing that really helped me in treatment, because as they do the obinutuzumab and venetoclax, you have to get stuck like 3 times a day. And so I saw a phlebotomist a lot. And so I thought, okay, I've got to figure out how to go. So I would ask each person I saw those days how their day was going. And I just asked them, you know, and it was like all of a sudden they would start talking, and it could just for a few minutes help me not to think about the worries or the anxiety. So that's all I have to share, Sally, and I'm really grateful to be here. And I also, you know, just I know, like Lou said, you guys and we're all doing hard things, some harder than others. Like right now, I'm kind of coasting, but that I'm really holding you guys all in great regard, and really I like to know where you are and what you're going through so I can center my good thoughts and prayers towards that.
Thank you, Nancy. I agree with you 100% on the gratitude. And the other thing is giving back. And I think Lou and I have found that it helps our relationship with myeloma when we're trying to help other people, especially the newly diagnosed and who are walking around with deer in the headlights look, because they've never heard of the disease.
Oh yeah, that was me. Lynn Bailey was my sort of game warden.
Well, I think most of you know I relapsed a year ago in May, and they put me on venetoclax and kyprolis for that year, and my light chains were going up, even with the venetoclax. I was on 400, and unlike CLL, they don't step up the dosages; they hit you all at once with a full dose. So, and I never had any problems with it, but it didn't work for me. So I went back to Revlimid because I had not become refractory to it. Um, and after the first month, my light chains are coming down again. Yay! But because I was so sick today, I couldn't get another treatment, but I'm still on Revlimid every night. I didn't get my infusion today. They said, we don't want your germs. But I had a PET scan yesterday, and believe it or not, I got results in 3 hours. I mean, he called me.
Wow.
My doctor called me in 3 hours, and I couldn't believe it. I was at first when he called, I thought, "Oh God, what's wrong?" You always go back to the worst scenario. But he said, "No, I have no new lytic lesions since November of 22." So that's a good thing. Even though that I've relapsed, there is no additional tumor burden. So I've become non-secretory, which means I don't have an M spike, so we can't trace my other than my light chains, we can't find out what the myeloma is doing. So that means more bone marrow biopsies. But I praise the Lord that my doctor and his assistant both can do it in the office, and I don't feel a thing. Because I was the greatest advocate for sedation for about 4 years, because when I was at City of Hope, they killed me in the first bone marrow biopsy, and I swore I'd never do it again. But anyway, I haven't got the results back from that yet, so we don't know what the genetic changes are. We are assuming there's a new clone that's out there that's resistant again. So we were looking at CAR T, and all of a sudden I heard a rumor. I haven't heard this directly from the doctor, but you know how hospitals are. Everybody knows everything before you do. The insurance company has denied it. So I'll find out in a week when I have my appointment with Dr. Avenor, but um, I'm not as worried about it as I was. So hopefully things are going well. And other than recurring chest colds, which I've had since I was 3 years old, I'm fine. And I don't, like I say, I don't feel as poorly as I sound. So, anybody else have anything to say?
I've got some update here.
Oh, good.
Yeah, Leslie asked me a while ago about Paul, who joined us 2 or 3 months ago. I've got two friends that were coworkers. When I say coworkers, we had about 3,000 employees, but they were people that I knew, and it's not like we have a great outbreak of blood cancer where I work. But um, Paul, who joined us, has mantle cell, and he was being treated with bendamustine and rituximab, and he has completed his treatment. This was his initial treatment for mantle cell, and he's in clinical remission, doing well. And he has only joined us on that one video call. I think he was participated, and I think he enjoyed it. But probably at this point, he'd like to go on with his life and not be involved in a lot of discussion about cancer. Um, Now the other fella, his name is Billy, and he lives here in Abilene, and he's been having a really rough time. And I only get periodic updates. He's got follicular lymphoma, also being treated with the same treatment, the bendamustine and rituximab. And after his first treatment, he became very anemic, and they were giving him blood infusions. And then he began to break out, and his skin began to peel. He had edema, the mucus, his eyes and mouth. He had sores in his mouth, and this was back in I want to say in June when this all started. And in a gentle way as I could, I continued to push that he might want to talk to some of the experts and get away from the community doctors or get some additional help. And finally, his doctor here was saying that he wanted to get him linked up with a doctor at UT Southwest who specialized in bone marrow failure. But I don't know if that's happened because I only get an update about every 2 or 3 weeks. And the last update I got was that Billy has ulcers in his eyes, and it's affecting his vision, and he has not been able to see very well. I want to say for about 2 months now. And the local ophthalmologist said, I want you to go to the emergency room at UT Southwest in Dallas. And so the last note from his wife is that he's under the care of a ophthalmologist in Dallas. This was about 7 or 8 days ago that I got this note. And I got to looking online, you know how we are. We get to trying to diagnose other people's problems. But what I came across was something called Stevens-Johnson syndrome. And I put a link to it in the chat. And Alexa nodded her head when I mentioned this. I think she had heard of it before too. But it was the same symptoms that he was having, and in severe cases it can affect the eyesight. So hopefully they're able to do something. But from what I read, you're more susceptible if you have a compromised immune system. You have reaction to certain drugs and so forth. Alexa, you want to chime in and say anything?
Yeah, it's so important that it's caught early. It can be deadly, and if you see signs of it, you need to get medical treatment right away. Yeah, I also think there needs to be more awareness of it because so many different medications and medical conditions can cause it as well. So I'm really glad that you brought this to the group tonight.
Yeah, I mean, fortunately, it's rare, and I think
Yes, very
he,
rare.
I think Billy's the only person I ever came across that sounds like this might be the condition that he has. But anyway, and it would be understandable that the local doctors would not know what to think of it. They sent him to the burn clinic in Lubbock by helicopter because they thought this was some type of burn on his body. and they got there and said, no, this is not a burn condition. This is an infection condition. So, and of course, most of my experiences with CLL, and I have never heard anything like this with CLL. But when you read up on it on the internet, it can be a side effect of drug reactions and compromised immune system and so forth and so on. So I don't know what the latest is there. As far as my own situation, I continue on a drug holiday. I'll be going to see my doctor 6-month checkup next week, and I expect it to just be routine. Al, I would like to encourage you. We've got 2 people that join us on our Blood Cancer Uncensored call that have been through bone marrow transplants. One is Jenny. Jenny had a bone marrow transplant back about 2001 for DBCL, something like that, double. I don't remember what that stands for, but it's a type of blood cancer. And then just recently, we have a fellow named Corey who has been through bone marrow transplant and stem cell transplant, and he's out 100 days plus now, doing very well. It was kind of rocky. I know at times he didn't join us; he just was not up to it. But anyway, he's joined us the last. We meet twice a month, and he's joined us, and he's really upbeat and really feeling well now. And I don't know whether Nancy remembers what his diagnosis was. I think it was some type of leukemia, is what I think, but I'd have to look at my notes to see. And that's about it from here, where we've had about a rain report here, 4.1 inches, and we needed it really bad. And we had a slow rain started on Sunday and ended on Wednesday, really starting to green things up.
Good. I'm glad you put that link out here on the Steven Johnson syndrome causes, because it says most common causes is an adverse drug reaction, and any drug can result in this, but medicines such as antibiotics, anticonvulsants, and anti-inflammatory agents most frequently cause this and is more common in younger children or younger people. But anybody who has a weakened immune system or people going through chemotherapy are very susceptible. So that's a good, I had never heard of it before, and I'm glad you brought it up. Thank
I
you.
have no confirmation that is what his condition has been diagnosed as being, but it sure looks like it to me because
Yeah. Well, you're pretty good at diagnosing things. You've been doing this for a while. Does anybody have anything else? Alexa, do you have things about next meetings or the art classes or anything?
Well, thank you, Sally.
Wait a minute.
Well,
Alexa, no. Thank you.
yes. I can still hear her talking. Yes, as always, we do have an art class coming up. Hannah hasn't delivered the project yet. She hasn't sent it to me, but we do have an art class coming up. I think it's on the 15th. No, it's on the 19th this month. And you can go ahead and register here. I'll put it in the chat. And I actually want Jim to make an announcement. We had a huge change to the veterans group. And I would love for him to make an announcement about that real quick.
Yeah, the veterans group switched from a single time a month on a Thursday, on the 4th Thursday, and now we're the 1st and 3rd Tuesdays in the Schmear room here. So it will hopefully draw more, because a single time a month was a little bit hard, and really hard to get the guys, and we'd wait for 2 weeks or 3 weeks to um, to then bring things up to me. So it started out slow on Tuesday night, only probably 5 to 6 of us, but it was a holiday one, so we'll see how it goes. And I thank
Thank
you.
you.
I thank you, Alexa, for arranging all of that stuff.
Of course, Jim, and we thank you as well. And I also want to say thank you to Lynn and Nancy for the book Bucky. It is fantastic. I'm hoping to get a signed copy eventually. And I would like to just do a quick commentary. I love how the art progresses. It is a very nice touch. If you have not read the book yet, as we discussed last time, the art style is very fantastic, but we have a great artist on the call and it tells the story quite well. So those are all the announcements from me. You're muted, Sally.
I was trying to mute so he didn't have to hear me cough. I said, I appreciate all your help and everything, and we hope that Michelle starts feeling better. And oh, I have an announcement. I'm going to see her in Boston on the 22nd of September. I'm going to Maine for a week, and I'm driving, so I've rearranged my schedule so the way I can work it so I can get there early on the 22nd and have lunch with her and go on up to Maine. So it's nice to be able to see somebody besides Lou in person. So thank you all, and I hope you all don't, get whatever is going around because it
I have
is.
a question for Nancy before we get off.
Sure.
Nancy, will you be back in Texas the next time this call takes place?
Yes, I think, yes, I should. And our ranch, which is fairly close to Lynn, I think parts of it got 9 inches of rain. There was some real downpours coming. It was really good. But yeah, we head out of Vermont on September 29th. So we will be going across. And Sally, you need to ask Michelle. But I think she said that they're going to do an Instagram, and it's going to be a talk on sexual intimacy. So maybe I thought she said it was September 22nd. Maybe she thought you were going to lead that out.
No way.
Oh, and I'm sorry about all the guys, because it's just for girls. So,
Yeah.
Oh, wait a minute. What's the deal? I wanted to join the call.
well, you're not a woman, so I mean, unless you're gender fluid, and if you are, then I guess
Then everything goes.
yeah.
All right.
I'm not that fluid.
I'll put my wife on the call, but we'll mute